Good afternoon. My name is Nicole Kaufman. I'm a consultant with Mercer, and Mercer, along with Health Tech Solutions, are working with the Department for Medicaid Services to implement the Medicaid Advisory Committee and Beneficiary Advisory Council, which present a new framework for Medicaid beneficiary and external partner input. This is the first virtual forum on the topic. The second forum is on this Wednesday, December 18th, from 1:30 to 3 p.m. Eastern Time. The prepared remarks, right, and foundational content is the same in each forum. Next slide, please. All right, first we have just a couple of housekeeping items. Your lines are muted. You can submit questions in the Q&A option in the bottom ribbon of your Zoom screen. Reminders on how to ask a question or share a comment during the discussion section will be provided at that point during the forum. This webinar is being recorded, so please avoid sharing any protected health information. If you need help with Zoom capabilities or any of the functions of Zoom, please send a question through the Q&A function to a meeting host. And then finally, please limit your questions and comments to the MAC and BAC, the topics of today's discussion. Next slide, please. I now have the sincere pleasure of introducing Senior Deputy Commissioner Veronica Judy Cecil to welcome all of you and to share some opening thoughts.
Thank you, Nicole. On behalf of Commissioner Lisa Lee and the rest of the department, we appreciate you taking the time to be here today, whether it's in the live recording or in at some point later. We appreciate that you've taken the time to participate in this forum. As Nicole mentioned, Medicaid has engaged Health Tech Solutions and Mercer to assist us with this initiative. They're helping us host today's forum, but they will also be providing support as we move forward to ensure that we are compliant with all federal requirements. And in particular, we have engaged them to help us with convening people with lived experiences so that we create a framework that is easy to navigate and permits really meaningful engagement. Next slide. Our objectives today include understanding the new requirements. We'll be going through those and hopefully in a way that will explain in an easy way to understand what it is that we have to comply with. We're going to discuss the changes that may occur for the current Advisory Council for Medical Assistance and the current Technical Advisory Committee structure. We are also here to hear from you. We'd like your input on the key design elements for the changes to the MAC and the creation of the new BAC. We appreciate you being here, and we look forward to answering any questions, to hear your feedback. We really hope you take this opportunity to provide that for us today. Thank you.
Thank you so much. And as a reminder, right, a copy of today's presentation, as well as the recordings, will be posted on the Department for Medicaid Services website, and that will happen after the session, the second session, which occurs on Wednesday. All right, next slide, please. Okay, so what's new? Why have we convened all of you this week? So new federal rules require all Medicaid programs across the country to have 2 distinct advisory groups by July of 2025. The Medicaid Advisory Committee, or MAC, and the Beneficiary Advisory Council, or BAC. The new MAC and BAC framework is really designed to promote the voices of individuals with lived experience with Medicaid and to support diverse and representative advice on the Medicaid program. This new framework also expands the focus areas for the MAC and BAC to advise Medicaid agencies on. So these focus areas include coordination and access to quality services, additions or modifications to benefits, eligibility, enrollment, and renewal processes, beneficiary or provider provider communications, and then health disparities, health equity, and cultural competency. So with all of these changes to the framework, what opportunities lie ahead? So Kentucky aims to go beyond federal compliance, right, and just checking off the boxes to really enhance how input is received and to expand perspectives on the Medicaid program. The aim is to work collaboratively to make Medicaid better for all Kentuckians. So how is Kentucky Medicaid directly impacted? The new federal rules, as we'll discuss in more detail, will require changes to the Advisory Council for Medical Assistance, so Kentucky's current MAC. It will require the creation of a distinct Beneficiary Advisory Council, BAC, and then rethinking the Technical Advisory Committees, or TACs. Next slide, please. So to understand what opportunities lie ahead, we will spend a few minutes covering the current Advisory Council on Medical Assistance, as well as the Technical Advisory Committees. So today, the Advisory Council advises the Department for Medicaid Services on Medicaid health and medical care, right? And if you've attended any of these meetings or looked at the agendas, right, the scope of topics covered, go beyond just medical care topics. In terms of size and the term for members on the MAC, there are currently 22 members, and they serve a 4-year term. In terms of what voices comprise the 22 members on the MAC, there are 13 provider associations, 5 consumer advocacy groups, 3 Medicaid beneficiaries, and then Commissioner Lee. Provider associations that have representation might include the Kentucky Medical Association, and then association representatives for dentists, healthcare facilities, home health, hospice and palliative care, hospitals, medical equipment suppliers, nursing facilities, optometry, pharmacy, podiatry, and primary care. Consumer advocacy groups that have representation on the current Advisory Council represent individuals with disabilities, the elderly, women, minorities, and persons returning to society from incarceration. That position is currently vacant. Members on the MAC are appointed by the governor today. The MAC holds meetings at least every other month, and those meetings are public virtual meetings that are subject to the Kentucky Open Records and Open Meeting laws. Next slide, please. All right, let's shift gears and talk about the current Technical Assistance Committees, or TACs. The TACs act as advisors to the Advisory Council for Medical Assistance. Each TAC represents a specific provider type or are individuals representing Medicaid beneficiaries. There are currently 17 TACs with 5 to 12 members per TAC, and members serve until a replacement is selected. Representation across these TACs, there are 14 provider types, and then 3 TACs that are beneficiary focused. So in terms of the provider types that have a distinct TAC, you have behavioral health, children's health, dental, home health, hospital care, intellectual and developmental disabilities, nursing facilities, optometry, pharmacy, physician services, primary care, and therapy. The beneficiary focus groups that have their own TAC. You have the Consumer Rights and Client Need TAC, the Disparity and Equity TAC, and then the TAC focused on persons returning to society from incarceration. Members that serve on these across these 17 TACs are primarily appointed by the affiliated provider association for that TAC or the affiliated advocacy group. TACs convene quarterly or more frequently, so it varies. And then the meeting format, similar to the advisory council, the public virtual meetings subject to the Kentucky open records and open meeting laws. Next slide, please. All right, so let's spend a few moments talking about what's to come and the areas that we're really going to want your thoughts on. So there's a new federally required framework for the MAC. So the role is going to be similar as the advisory council, and that's to advise the Department for Medicaid Services on policy development and administration of the Medicaid program. Membership requires at least one representative from advocacy groups that work with Medicaid beneficiaries, clinical providers, managed care organizations, and other Commonwealth agencies that work with the Medicaid population. There is also an expanded role for individuals with lived experience as a Medicaid beneficiary or parent or caregiver on the MAC. In terms of selection of members on the MAC, they must be selected by the Medicaid commissioner. While the federal rules do not say how long members serve on the MAC, the regulations do specify that members cannot serve back-to-back terms. The MAC must meet at least quarterly, and then at least 2 meetings per year must be public. So a few areas to highlight in terms of similarities or differences between the MAC and the current advisory council. So the role as an advisor to the Department for Medicaid Services does not change. It does expand membership to MCOs and other Commonwealth agencies that work with the Medicaid population. Some members on the Beneficiary Advisory Committee must also be on the MAC. The process for selecting members will change. Right? Today, membership on the Advisory Council is done by the governor. Members cannot serve back-to-back terms. And then the MAC does have a deliverable, a required report each year that summarizes the activities over the year, recommendations, and work that was conducted during that year. Next slide, please. All right, now turning to the new federally required Beneficiary Advisory Council. So the BAC is a dedicated and supported space for individuals with lived Medicaid experience to identify issues, to bring to the MAC, and then also to directly advise the Department for Medicaid Services. Now, membership on the BAC is comprised solely of current or former Medicaid beneficiaries, their family members, and paid or unpaid caregivers. As with the MAC, members on the BAC must be selected by the Medicaid commissioner. Again, while the federal government does not say how long members can serve on the BAC, they do specify that members cannot serve back-to-back terms. Meeting frequency, the BAC must meet separately from and before each MAC meeting. And that's to really ensure that BAC members are prepared for the topics, so I feel comfortable coming to the MAC meeting and sharing their thoughts. And then meeting format, the BAC has the authority, or the ability to decide which meetings, if any, are open to the public. So a couple of areas to highlight in terms of distinctions for the BAC moving forward. BAC membership is only for individuals with lived Medicaid experience, So as a beneficiary, family member, or caregiver. Again, members cannot serve back-to-back terms. And then BAC meetings do not need to be public, So the BAC reserves the ability to say which meetings are in fact public. All right, next slide, please. And I do believe we've had a couple of questions come in. Let's see here. All right, so I do see a question about how does one become a member of these advisory committees. This is certainly a topic for today's discussion. We want to hear from all of you as to how that selection process could work. Let me see here, forgive me. Okay, so I see Taran Herthel, you have a question. I'm going to unmute your line if you would still like to answer, sorry, to ask your question. Let's see, are you able to unmute your line? No, there we go. I think I might be able to do this for you. Let's see here. I may need someone more astute with Zoom here. I'm having issues getting, are you able to unmute your line?
It looks like, Taran, we're trying to give you the opportunity to unmute and it is not allowing. So let's try, it looks like Ms. Harris has a question as well. Let's see if the functionality works there. And if we still have an issue, we will sort through that. So I'm going to go ahead and unmute Ms. Harris here. Okay. It looks like it is not giving folks an opportunity to unmute. So we will have folks work on that on the back end, and then we will come back to the raised hand questions and make sure we get those addressed. If you want to submit your question in writing, we are seeing those come through in the Q&A functionality at the bottom of your Zoom. So please feel free to submit that way. We will figure out how to let folks off mute though, and give that another shot. In the meantime, Nicole, do you want to go ahead and move through the questions that are coming in the Q&A? Or should we go ahead and move to the next slide and then start to work through those answers as we get into that content?
Certainly, yes. So I think that a number of the questions are very good ones, right? And as mentioned at the outset, we do not, we are in the planning phases, right? And so we want to address a number of the key elements, right, for the MAC and BAC and hear your thoughts as to how some of the things like qualifications, the application process, and all of that should work to make sure that it's the most supportive and effective framework. So to help us in that, I am going to turn it over to my colleague Shannon Kojasoy, and she is going to get the discussion going on these several topic areas. So Shannon?
Great. Thank you for that, Nicole. And as we navigate the ability to unmute and mute all of you, we will pivot if needed for some of your follow-up. We will just read it from the questions so we make sure your voices are being heard. But as Nicole just shared, really wanted to tee up an overview of the current advisory framework so that everyone in this virtual room understands that current state, shared a little bit about those federal requirements, what is to be considered as the state moves in and develops that next framework, that required framework as highlighted. And but really being cognizant that the role of advising the state will not change. Really want to make sure that's clear. The intent is that advisory capacity will remain. And so the next few slides are really just helping tee up some questions so we can help focus that key design. Those will focus on our first slide. We'll talk about MAC membership, questions about size, to hear from all of you, your feedback and your thoughts. Then the BAC membership, again, that new committee that Nicole just briefly provided some overview on. Then we'll look to the MAC and BAC member length of appointment. So really looking to see how long should a member be able to serve as a member of either of these committees, the meeting frequencies for the MAC and BAC, and then how to support MAC and BAC members. And really looking to expand that to make sure that we're teeing this up so that you can provide and support and provide that necessarily feedback to the state. So with that, we'll move to our next slide. We can move to the next slide. Thank you. And as I said, this is about the MAC membership. So just to bring up in front of all of you again, currently there are 22 members on the MAC. And so we want to hear from all of you as to how that experience is currently working. And so Brian, I'm going to see if we can take you off mute and hear from you, from your perspective, how that current size of the MAC is going.
Well, can you hear me?
We can. Wonderful. Welcome.
Great. Awesome. Thank you so much. Well, I just looked up and Googled who's actually on the current MAC. And to be honest, my question is, can you tell us the last 2 or 3 things that the MAC has advised the cabinet on and what the outcome of those were? Because honestly, I have not seen any, I've not personally seen any results of the work that they've done.
Well, and thank you for that, Brian. And we may be able to share some of those details, but too, for those of you otherwise in the room, also looking to just get a sense of the size of that membership. If 22 is too big, is it too small? So looking for that perspective. I did see Veronica come on camera. If anybody wants to share other responses to Brian's question, we can address those too, but then we'll look to that size question.
Yeah,
Yeah,
I appreciate that question, Brian. And I don't know if you go and watch the MAC or if you've been participating in the MAC, and we've got all of those recorded and on our website. We do get regular recommendations from the MAC, but I think we really want to focus today on what the new structure looks like. So I appreciate that.
Brian, do you have
Yeah,
another response?
thank you. Yeah, just to follow up on that, I guess my question was, in your all's experience, has the current membership been very beneficial? Has it not been beneficial? And I was curious as to what actions they have been a part of that have made them beneficial. Looking at the membership, it seems there's only, I think, 3 members from the general Medicaid lived experience population. And working or hearing from like my spouse works on the prevention side with the other members in Medicaid, where they're trying to be really proactive in getting the voice of people who are actually having that lived experience in these programs. It seemed like that number needs to grow. So I think of the 22 members, if that number seems to be working, that maybe that needs to be adjusted, or there needs to be more room for additional voices from people who actually have lived experience in the Medicaid system. That would be my recommendation.
Thank you, Brian, for that, and actually for providing feedback on a question that comes a little bit later as well, is how to balance that membership from those with lived experience to those who maybe don't have that lived experience. So I really appreciate that. And I'd like to take some of your words and actually expand it out to the rest of the group. Is there anyone in this virtual room who has participated in the MAC and can maybe speak from their experience how that size, that membership has felt? Does 22 members feel the right size? Is it too big? Is it too small? Garth, oh, sorry, Nicole.
You're okay. We're figuring out how to open these up here timely. So that looked like Garth had a question. I unmuted you, Garth. Can we hear you?
Yeah, can
Garth,
you hear me now?
Yes,
We
we
can.
can.
Hello? Hello?
Yes, Garth. Garth, can you hear us? We can hear you.
Okay. I'm a current member on the. Yes, I can hear you. I was just following up with Brian's question. I'm a current member of the MAC, and typically it has been a single representative from each of the TACs, and there is a consumer member on the MAC. And to try to answer some of your questions on, well, what are they talk about? What's asked of the TAC and MACs? Sometimes they are procedural questions. Sometimes it's informational questions on what services are offered. Sometimes how's that going? Is it a service that's offered but rarely used? Sometimes they can look at those rarely used things and maybe put more effort into items that are more used or more needed by the population group. But I've been on the MAC for over 4 years now, so have a little experience with it.
That's excellent, Garth. Thank you for that. And then thinking of your role sitting on that committee for 4 years, has the size of that membership felt right-sized?
It has, because it does give a representation of each health area. So I felt like it was well represented across the board.
Excellent. Thank you, Garth. I want to move to another couple questions just on some of the makeup of the MAC. But before I do, is there anyone else with feedback on the size of that membership? Nicole, did you have anything else to add? You've maybe seen in the responses coming through?
Yes, and it looked like one hand went up. I'm gonna
Oh.
really quickly let looks like, and I apologize if I don't get folks' names correctly, but it looked like Eltra had some feedback to provide. So let me go ahead and open that up. Can we hear you?
I believe I have unmuted. And
Yes,
so
you have.
thank you. And so in regards to the size of the current MAC, I believe he said that each discipline was represented by one member. And my question is the move to increase the number of experienced or lived through panelists or persons to 3 to 5 or 7, or is it will that live through experience be limited to 1 as well?
I think today we're looking to hear from you, your recommendations of how you would like to see that interpreted. And so if you have a recommendation on size or specific roles, it would be great to hear them. And in fact, maybe I'll just
Yes,
bring it. Oh, sure, Eltra, I'll hear from you first, and then our next question, we'll dive into it a little further. So what would you recommend?
I would recommend it be 3 to 5 persons who have lived through experience, only because of the broad panelists or the broad disciplines that are covered. Because I noticed that it had primary care and some other disciplines there, as long as now including MCOs, just so that there is a variety or wide enough or broad enough way to capture the experience of the live through.
So Eltra, you raised
Because
a key point, and it reminds me of an important requirement that I neglected to give due attention to in the opening background information. So we talked about how there's the MAC, right? And then the BAC, right? The BAC is all individuals, right, with lived Medicaid experience. However, there needs to be crossover membership, right? So some members of the BAC need to also have a seat at the MAC. And federal law requires by, I think it's 2027, that 25% of the MAC number of participants, right, needs to be those individuals with lived Medicaid experience. So there is an expectation that at least 25% of that total number, right, that comprises the MAC are individuals that are also on the Beneficiary Advisory Committee.
Great. Thank you for that, Nicole. So I think that does really support what you're saying, Eltra, is that having that 3 to 5 persons with lived experience on that committee sounds like will align really well with what is being recommended from or being required from the federal government. Could we bring in the next question? Because it kind of builds a bit to go even further into who are these members. So there are currently 13 provider associations, 5 consumer advocacy groups, 3 Medicaid beneficiaries. So again, to Eltra, I think you're recommending 3 to 5. We see that as a strong recommendation. And then the Medicaid Commission and the Medicaid Commissioner is also on the MAC. For those of you who are either currently on the MAC or aware of that membership, is this too many groups, or are there groups missing? Are there voices not in this group that you want to make sure have an opportunity to provide that feedback?
Thanks, Shannon. So I think I saw Steven's hand go up, and then we'll go to Brian. Steven, you should be able to talk.
Can you hear me now?
We can hear you.
Okay. Well, my comment, first of all, would be that please don't forget that a lot of these provider groups fought really hard for their TAC and their seat on the MAC. And there's a surprising lack of overlap in the Medicaid experience between these different provider groups. So I am concerned as we try to meet the percentages and things that are required, that there's the chance as we add people to this group that it's going to get too large to be truly functional, because we're already at 22. And I absolutely don't want to see anyone lose their voice, because this is their primary part where they can get together and talk with other provider groups, because the TACs are provider specific. It's only at the MAC that they get together and they sort of discuss things in an overall way. So as we change this group, I really hope that we're going to keep that, because there are a lot of groups that can get lost in the shuffle that are smaller parts of Medicaid, but still vitally important to the program.
Thank you for that, Stephen. That's great feedback. With that in mind, are you open to a slightly larger membership of that MAC to make sure we don't lose out on some important voices? Or are there particular groups that you want to make sure remain?
Well, I think if you asked each individual provider group, they are really hoping to maintain their membership. Are there other groups that need to be added? I don't know. I mean, my expertise is in my one specific provider group. I'm not sure if there are other groups that would like to be heard. I'm not sure how many groups there are that don't have their own TAC. Right now it's set up so that each TAC gets a representative on the MAC. I think, we just need to, I know that everybody's excited about maybe increasing the involvement of the people that are utilizing the program, but for a lot of the people that don't work on a regular basis with the providers, I don't think they understand the struggles and the frustrations that the providers also have on a regular basis. And that's why the MAC is vitally important.
Great. Thank you so much for that, Stephen. we will make sure to capture that. And I think in our next questions too, we're going to dive into that a little bit further and look forward to maybe hearing your voice again. Nicole, do we have anyone else up for questions?
Yeah,
Or
it
for,
looks like
excuse
we
me,
have
feedback.
feedback. It looks like Brian wanted to weigh in again, and then we've got two other hands. So Brian, can we hear you?
Sure, thank you so much. Looking at the current makeup on the website, it looks like you all have a vacant position also for hospice and palliative care. Is that correct? Or is that different?
I can't speak to the current membership right now, but is that a recommendation that you want to make sure that voice is a member of that, the MAC
Yes,
moving forward?
we should definitely include that. And then I also don't see anything related to behavioral health and mental health. I don't see that type of group listed here. And I think that's vitally important as well.
Great. Thank you for that, Brian.
And then
Thanks,
one
Brian.
other quick comment is I come from a background of being both in the provider world. I've been home health and hospice advocate for over 30 years, but I also have lived experience with both my mother in the Medicaid program and an autistic grandson. And so while I know having provider representation is extremely important, being on the flip end and being a recipient or a family member of a recipient, if you don't have an advocating provider that's going to advocate for you, then the voice of the recipient is lost. And so I think back to the makeup of the board and expansion of that, I would definitely support its expansion because adding those additional, lived experience is really what makes a difference in any program and hearing those voices. So I would advocate strongly for, increasing the number to make sure that at least 5 to 6 are included in our representation.
Excellent. Thank you for that, Brian. I'm seeing some great use of the reaction emojis too, supporting that feedback. So we appreciate that.
All right, so I'm going to pull one from the chat, and then I will take the next raised hand off mute. There were two responses
Am I
in the
muted?
chat. Oh,
I just
Stephen, you are not.
Oh,
There you go. Thank you. That said they believe that the current size is actually the right size for the MAC. So I was submitting that feedback. And then there was a hand up from Rolanda. I'm going to pull you off mute.
Hello.
hello.
I just wanted to advocate for the lived experience, and I just really feel like that if we really take the time to sort of conceptualize things, is there, affecting everybody? You can't have the voice of a few be the voice for many. So while I can understand the provider associations and different ones, not wanting it to get too out of control. They are looking at it from their perspective, and somebody has to start advocating for the people that are actually having to deal with the red tape because of a family member in a nursing home or can't get the treatment that they need. So I think it's very, very important to have people with lived experience on the committee as well. That was just all.
Thank you for that, Rolanda. That's great feedback. And again, we're seeing a lot of support for that. Can we just bring in our next question? And those with your hands up, we still want to hear from you. But our next question, I think, gets to a bit of what we're hearing is there's some support for this current size, 22 members. We've heard from others saying, hey, we're okay with some expansion, going a bit larger, if we can make sure those voices are heard. If we bring in our next question, I wanted to just propose this and get feedback. And again, Rolanda would love to hear from you again if you would like, but using subcommittees could be one way to talk about topics in more details. It may also provide more opportunities to participate in this process. So just wanted to add that into the mix to get your thoughts on using subcommittees as part of the MAC. Again, please be candid, share your opportunities and challenges, but looking to make sure we're hearing from a lot of voices in this process. That's one way we might be able to
Thanks, Shannon. There are a lot of notes in the Q&A, and we want to thank you all for that feedback as well. And just remind folks that that is not being ignored. All of that will be captured as well following the forum. But we do love hearing from you all live as well. So we'll keep working through those hands. So I think, Michelle, we'll take you off mute.
Hi, this is Michelle with the Children's Alliance. Can you hear me?
Yes.
Great. I would just recommend that we definitely have a voice for behavioral health and substance abuse providers. And also, again, Medicaid recipients as well. And also, I would agree that we need to make sure that there's representation from each of the subcommittees on the MAC so that the work that's done in the subcommittees can definitely be looked at, talked about, etc.
Great. Thank you for that, Michelle, and capturing that additional too to make sure that substance abuse providers are a key component.
Miriam?
Yes. Can you hear me?
Yes.
I have a question about, or a suggestion, I guess, about all of these subcommittees for each provider group that there is. Can there be a recipient, I guess, in a committee, like you said, a subcommittee with them? I think that a recipient from each of those providers would really help them understand. Because again, I understand that the providers have worked hard to be there. They have their set of challenges, but the bottom line is this is for people that are on the Medicaid, on the services, and I also would love to see the mental health, behavioral health needs to be expanded. That is the biggest that I see deficit we have that leads to so many problems.
Excellent. Thank you for that, Miriam. And just to be clear, so it sounds like you're recommending that for every provider associate on the MAC, there is a corresponding recipient, possibly on a subcommittee, to make sure those voices are heard.
Yes, I think that those people need to hear from what are those people using and what their problems are, and then maybe they can bring it back to the big MAC committee.
Excellent. Thank you for that.
Mm-hmm.
Seeing a lot of support there too.
All right, Renee?
And I am representing a rural health clinic in London, Kentucky. And my question is, on this advisory board, are there representatives of rural health clinics and or FQHCs?
And so not speaking to the current plan, the current advisory, but is that your recommendation, Renee? You want to make sure those rural and FAQ representatives are participants.
Absolutely, because at our rural health clinic, we have a multifunctional facility. We have women's health, primary care, pediatric care, dental, and behavioral health. So we could be representatives of multi different entities.
Excellent. Thank you for that, Renee. And just to make sure we can get through all the slides and hear from all of you, we will maybe take two more, a little feedback from, it looks like Amy and Holly, and then we'll move on to our next slides.
Great. So Amy, we should be able to hear from you.
Sorry, can you hear me?
Yes.
Okay. My name is Amy Stade. I'm the CEO of the Kentucky Association of Private Providers. We're Kentucky's trade association for IDD service providers. Regarding the subcommittees, for those on this call who don't know, the TACs pretty much act as subcommittees already. And I think that that system works really well. So every single TAC has a representative on the MAC. And just to be clear for those concerned, there is a behavioral health TAC that does have a representative on the MAC. And so I think that the TAC system works really well. The TACs have their own members that represent, a broad spectrum of interests. I can't speak for every TAC, but at least the IDD TAC, we have parent members, consumer representative, provider members. There's a pretty broad scope of people who are members of that. And obviously the TACs do have representation on the MAC. And I think that system works really well and ensures that the information is getting through the MAC. And also the TACs, again, can't speak for every TAC, but the TACs work through some really complex niche problems that the MAC doesn't necessarily need to handle, and some things can get just worked out at the TAC level. And I really hate to see, that kind of collaborative process go away.
Great. Thank you for that, Amy. And we have some follow-up questions on later slides that touch on the tax again. So I hope to hear your voice again, but we will capture that.
Thanks, Amy. And there were a number of folks wanting to make sure that we relayed that information about the BH coming through the comments. So thanks for taking that opportunity, Amy. And it looks like we'll take off Holly before then we move on. Holly, we should be able to hear you now.
Hi, I'm Holly Tolley, and I'm representing DaVita. We're an outpatient dialysis provider. And I think just common theme here, just want to represent our patient population as well. Since dialysis is it's a long-term, lifelong treatment in the majority of cases. Our patient population is aged, they're disabled. And so whether it makes sense to have a TAC or subcommittees, I do think just being able to have, our specific patient population be represented would be wonderful.
Great. Thank you for that, Holly. We will move to our next slide where we'll continue to build on this. So this moves into the BAC membership, but I think you'll see throughout we're going to kind of overlap a little bit with TAC and its role. But the BAC membership, as discussed earlier, these are positions on the MAC. There are positions on the MAC and some TACs for individuals currently on Medicaid with specific callouts for parents, individuals with intellectual and developmental disabilities and caregivers, and individuals re-entering society following incarceration. So we just heard from a lot of you that these lived experiences are very important and crucial voices participating in the MAC. Just wanted to take a little bit more time on this to make sure that we've captured all your thoughts. How do these voices impact the work of the MAC and TACs today? And we can go to our next question as well. Are there other lived experiences with Medicaid that should be included? So we did hear from many of you. Our just recent feedback from Holly included some additional voices. Any other voices that should be present that we want to make sure are present in the BAC membership?
Yeah, like Garth, your hand was up still from the last slide, but since they're related, I'll unmute and see if you wanted to add here, and then we'll move to Rolanda.
Yes, the one suggestion in listening to the other comments would be that the tax system does work well. The only thing that I would recommend there would be to allow the commissioner to add a live experience member to each TAC. Several of the TACs are set up by their respective agency or health group. Like there is a behavioral health TAC, a mental health TAC. Sometimes like the rural health clinics and FQHCs sometimes they may be kind of lumped into another TAC, for instance, like the primary care physicians TAC. So sometimes you do get some additional grouping, but maybe they could add a live experience member to each TAC. And I know another area to look at would be, and again, this may be lumped into primary care physicians, but there is a nursing TAC, but elder health care. And one of the challenges that they've got is a lot of stuff is online, but they don't understand how to use the computers, or some of them don't know how to use their phone to access this information. I know Commissioner Lee is working hard to get the community health workers established and expanded. So that may be a mechanism too that could help in the elder care group of our folks in Kentucky. Just an idea.
Well, and thank you for that, Garth. So thinking too, just to ask a follow-up question there, particular to the BAC membership. So this will be a group organized solely of former and current Medicaid beneficiaries. And I think there has been a lot of lessons learned within the tax and looking at those memberships and those voices. Are there particular voices that you want to make sure are part of the BAC membership? So this new group that will need to be created.
It sounds like the BAC membership looks like it, on paper. It looks like it's going to have a good representation, which, you're still going to have 25% of that BAC going on towards the MAC to share information. Like say, sometimes you can get committees so big that, I'm sorry to say it, but sometimes you don't get much done because of so much interaction, which is good. But I know the MAC meetings have already been expanded from 2 hours to 3 hours, and a lot of your MAC folks are active providers. So it being on these committees does require some time, which is good because it does allow for, I think, the proper interaction and idea sharing, and then you can follow up at them. And the from my experience on the MAC, we've had good leadership that folks bring up topics that were talked about at the last meeting that maybe just weren't finished. So we've had good leadership there.
Great. Thank you for that, Garth. And I think I see Theta's hand up.
The next, Shannon, I'm sorry, I saw Rolanda's hand come up, but
I apologize. Nope.
Okay. But tell me if I don't see the same folks as you, technology. So Rolanda, I'll unmute you.
Yes, I was late coming in, so I don't have some of the, I guess, form statistics you all are looking at. And so I wanted to know, is there are the people that work with the homeless population on there? Are unhoused? Because I know a lot of the social service workers and intake workers and nonprofits that work with them, they are also involved in making sure that they receive Medicaid, etc. So do they have a voice?
Excellent. We will add that as a recommendation, Rolanda. So we're hearing that those are voices you want to make sure are represented.
Yes, most definitely, because honestly, they are the ones that work with all of those people, and COC, they work with them. So they're going out there, meeting them where they are. And instead of being reactive when they come into the hospital, even if they're not using it, they have that insurance and they're able to access it at the time of need. So I think that's very important for them to have a voice.
Excellent. Thank you for that. And again, I'm just looking at the clock, so I want to be cognizant of the next couple of slides. We will still hear from those of you with your hands up, but I just want to bring in the next two questions so you can answer those as well if they feel appropriate and they tie into maybe your comments. The next one was just considering the role of the BAC as discussed earlier. So again, those current and former Medicaid beneficiaries, what would be a good sized membership for the BAC? So again, looking to hear from all of you, what size would be appropriate feel free to suggest some numbers from your experience, 20 members, 25 members, 5 members. And then the next question, federal regulations require that members are current or former Medicaid beneficiaries, family members, or caregivers. And so this, we can bring in the next two sub-bullets here. This was touched on a little bit earlier, but should there be a recommended balance between Medicaid beneficiaries, current and former, and family members and caregivers? And if so, what percentage should be family members and caregivers? And so we'll go back to those of you with your hands up. Just wanted to add a couple other questions in case you want to provide feedback.
Thanks, Shannon. So we're gonna go Theta, Steve, then Brian. So Theta.
Yeah, yeah. I apologize. I'm having a little bit of a cold. I'm currently a contracted lived expert for the state of Kentucky and nationally also. And I fully feel like there's a little bit of pushback in the room, maybe on lived experience being at that table. But I can tell you from experience on working with other areas of the state and other different arenas, especially child welfare, it has been nothing but beneficial. We have some councils that have nearly 50 people on it, and we meet and we, with, as he said, adequate leadership in those rooms, we have no trouble pushing through the agenda and getting through what needs to be done and everybody having a voice on that. But you cannot have a system in effect that doesn't have the people that it actually services in that system to give feedback on it. That being said, I also feel like you need someone as far as foster care, child welfare, experiences with Medicaid, due to the fact that there's a lot of problems there. They have a lot of trouble navigating that system. You know, if you have a child that's taken from a birth family, put into foster care, and the foster parents now have to pick up where the parent left off, and there's a lot of gap right there as some problems that, you know, navigating through the Medicare system to get that done. So, you know, if there's an area that needs some little bit of care, I think that one's it.
Thank you for that, Sita. And then looking at the BAC membership, which would be entirely those with lived experiences, do you recommend a balance between Medicaid beneficiaries and family members and caregivers? Or do you look at that as valuable voices that should be just looked at as one group?
I think every voice is valuable. I don't know that it should specifically be lumped in all together as one group, because every perspective is important on that. And as far as, no, I don't feel like that. I feel like you should, everybody's individual voice. I'm sorry. I've just been in too many meetings, and I mean, to the past 2 years since I've been doing this, been involved in too many councils where everybody's perspective on that is important. And it's brought so much insight to the group meetings and only made things better in the situations that we're working on currently in those groups. So no, I fully feel like everybody should have their own representation. I don't think we should lump anybody together with another, because each situation is different. Each perspective is different, and they deserve that recognition for that.
Great. Thank you for that, Theta.
Some folks come off mute, so I was going to pause. Was anybody trying to, from the panelist section, speak? Okay. All right, so then we're going to move to Steve Shannon. Should be able to hear from you. Steve, are you there? Okay. Steve, try and unmute if you see an opportunity to do that. In the meantime, Brian, I'll unmute you.
Thank you so much. Can you hear me?
Yes.
The first question on the MAC, the BAC size. I think it's really important, since that will be membership of lived experience people, that potentially you could structure it so that those people also serve on a TAC. You know, they can each be assigned to a TAC, because I think what you don't want to do is isolate those people into one group. It would be really beneficial, I think, for them to be involved in not just the BAC, but maybe assigned to each individual TAC. That way they apply to, or their lived experience applies to. I think that would be very beneficial. And then also you would have more people hearing their voices. It would be a way to expand their participation. And also, you know, they're not all going to be able to represent on the MAC, but they would have that opportunity to serve on both the BAC and a TAC as well, if they could, you know, have that amount of time to serve, not necessarily making a requirement, but something available to them. Because again, I don't think you want to isolate those voices into that one group and depend on all those voices getting heard at the MAC level. So I think expanding that and structuring it appropriately would be very, very important. I also think, you know, to me, a good size would be comparable to the MAC, you know, at least 20 to 30 people, because there's so many different programs that they participate in within Medicaid that it's going to be very important to have representation from someone who's been involved in mental health versus somebody who is, you know, representing the HCBW program. So you need to have the room and the space to really get feedback from all of those different areas, because Medicaid serves such a large population, you know, but you want to be able to hear from everybody. And then also, I think, you know, CMS is obviously clear. Like I said earlier, my wife works in the prevention field, and they have been doing this for years about getting more and more voices heard from the people who are in those systems. And I'm so glad. I think it was Theta that brought up the foster care. I think kinship care is very important as well. I've been involved with that personally. And that is a roller coaster, trying to, you know, deal with the system and knowing what your resources are and working through that system. So that is also very important. As far as the balance between Medicaid beneficiaries and family members, I think we have to remember that not all Medicare beneficiaries can participate or get there without a family member. And so I think, you know, striking that balance just to make sure that, again, that everybody is represented is very important. And we shouldn't really limit it or, you know, put percentages on it or anything like that, because we really have to rely on those that are committed and able to participate to be there. And those are my comments. Thank you.
Excellent. Thank you, Brian. Really appreciate that. And really appreciate the additional voices that I've heard mentioned throughout that you want to make sure are represented as a part of this. And I'm seeing a lot of connection then between the MAC and the BAC and subcommittees tax moving forward. So those are great recommendations. I think we can move on to our next series of questions. Now, this comes to the MAC and BAC member length of appointment. So really speaking to how long a member, once appointed to either the MAC or BAC, can remain on the MAC or BAC. So just highlighting one piece from the federal requirements, members cannot serve back-to-back appointments. So if you are serving for 4 years, that next 4-year block, you would not be able to you would not be able to serve. So it's just saying you can't serve in consecutive appointments. Currently, MAC members serve for 4 years with no limit on back-to-back appointments, so could stay on there indefinitely. The TAC members have no time limits and serve until their organization appoints someone new. So now really looking to the MAC and BAC as it's being federally required, we want to hear from you of what do you think about the amount of time a member serves on the MAC and BAC. So both this could be your suggestions on they should have a 2-year membership and then someone else has a turn, a 6-year membership, or how often, or feedback on that change from the back-to-back appointments as well. So we'll open it up for your feedback.
While we wait for hands to go up on these questions, there was some consistent feedback in the written section that I was going to share with you all. Kind of a consensus around ensuring that the autism population is represented, and also a lot of comments about area agencies on aging and or the Aging and Disability Resource Center, others to support that aging population, and particularly those using applications for the Medicaid waiver being mentioned in the written portion. And it looks like Eltra is raising her hand. So Eltra, I'll take you off mute.
Thank you. I represent the Live Through Experienced. And regarding the appointment time, I believe 4 years is adequate for representation on the MAC. But there does need to be a limit on back-to-back appointments. As well as for the TAC members, there needs to be a limit. I see that there are no time limits currently.
And Eltra, oh, sorry to interrupt you. Just with that piece, we provided the TAC membership as an example, but would love to hear your perspective on the BAC members, which will be that new committee of those with lived experience. So do you have a recommendation for a BAC membership for type?
Yes. And so my recommendation for the BAC membership type is to serve for 4 years with a time limit on back-to-back appointments. In that there are many changes that take place in Medicaid services and Medicaid offerings to live through experiences. And that information needs to be someone who is currently experiencing that rather than someone who is on the membership already and know how the system, know how this panel or this organization is set up and designed to work. We need those fresh membership. We need those fresh experiences from new members to also be able to rotate through and have that voice represented as well.
Excellent. Thank you for that, Eltra. And I'm also hearing you're maybe suggesting as well some staggering of those memberships so that you have kind of those old voices and new voices coming in together.
Yes.
Okay. Excellent. And we can bring in the next question, and then we'll hear from those of you with your hands up. Just one more area we'd like your feedback on as you provide feedback on the length of appointments. Just feel free to provide how you think that length of time the members on the MAC or BAC impact that role. And I think that's what we just heard a little bit as well from Itra as well.
Okay, so it looks like we have Brian and then Theta. Brian.
Sorry, guys.
It's great to hear.
Just based on experience with other types of committees like this, I think it's very important that we have consistency between all of them. So I would recommend that we have 4-year terms for both the MAC, BAC, and TAC, and that we place a limit on back-to-back appointments for all of them. And that way people, again, you get fresh voices, you get fresh feedback, you have people with current issues that they're having within the system. And, again, different perspectives are very important. Also, a lot can change in 4 years. Certainly my role or my experience with Medicaid with my mother was a lot different than my experience, 10 years later. So I would have had different questions and different issues at that time. And so I think it's very important that whether I'm in the provider role or whether I'm in the advocacy or family member role, that we constantly change and update our membership so that way we get the most current feedback from the industry and from people who have lived experience on what's currently going on within the system. And I know with some other, again, in the prevention realm with the Medicaid, Department of Medicaid, they are taking, people who have served for long lengths of time and they become more of a mentor in a mentor role. So possibly that could be something that you roll with prior membership, because those people do provide a lot of information, a lot of historical information that is very relevant sometimes. And so it's not that they cannot participate in the meetings, but they are not, the current membership. They are more in a mentorship role to make sure that we have access to that historical information. And that would be my recommendation. Thank you.
Thank you for that, Brian. That's a great recommendation. We appreciate that. And I think there was one more hand up.
Theta, yep. You should
Yeah,
be
it
able
was.
to come
I kind of echo the sentiment that they were onto there. I think that 4 years is good. I think if you have anything less than that, you run into the fact that you are involved in things and you're trying to build something. And sometimes a shorter term can cause more chaos than it can help in the long term goal. So 4 years, I think, is a good term. I don't think that it should be back to back. I do feel like you need that new blood. You need that new enthusiasm in there. But what he said prior to that might also think of a warm handoff for the new ones coming on to maybe, like you said, a mentorship or something, or that they're there. The prior individuals that were on the council are there to maybe help if there's any questions, just for a warm handoff is the best way I know to put terminology for that. But yeah, thank you all.
Excellent. Thank you, Theta. I appreciate that. And I know we have one more question, and then we'll move on to our next slide. One more response.
Priscilla.
Yes. Can you hear me okay?
Yeah.
I can hear you.
Yes, perfect. I really do want to echo what both Brian and Theta said. I agree with both of them about that term and that warm handoff and sort of staggering the terms of both of the members. I also want to really encourage that there is specific plans to do technical assistance and education with the members of the BAC. There's a lot of technical terms, a lot of jargon, a lot of just stuff that most folks just may not even know, may not understand, may not know how to navigate, or the questions to ask, or the things to point out, or any, just being very intentional about also including that education and technical assistance, so that members who are coming into the BAC feel supported and feel comfortable participating in a very meaningful way, that they feel confident sharing their lived experience, and that their lived experience is enough expertise, but that they can also still learn and pick up all of the information that they need to really participate in the conversation and be involved and help steer and point out policy issues and things like that.
Thank you, Priscilla, for that. I'm seeing our clock move fast towards the end of our time together, but we do have some questions on that coming up, and would love to hear from you again if we get to it, but we'll definitely note that as well, that support requirement for TA and education. Well, we'll move to our next slide. And this next one, we may move fairly quickly through it, but I want to make sure we hear from you all on it, because it is important. It's a big time commitment to support any of these committees. And so we want to hear any feedback of requiring that. So the new MAC and BAC will have to meet at least quarterly, but currently the MAC meets 6 times per year. And as was shared earlier, those are 2-hour meetings that now are 3-hour meetings. So it's a fairly significant commitment. And then just for a point of reference, about half of the TACs meet 6 times a year and half meet about 4 times a year. So just want to spend a few minutes here, hear from some of you, or feel free to put it in the question and answers column, your feedback. But how has that current meeting schedule worked for all of you who are participating in these? And we can come to the next question as well. Just what are some of the challenges and opportunities of meeting more often or less often?
While we wait for folks to think about things and raise their hands, sharing a couple more notes from some of our earlier discussion. There was, I think, a really interesting note about and piece of feedback about former Medicaid recipients who have been on the program at one time or another, and then been able to move into a self-support structure, and the kind of lessons that they've learned there, and participating in some of these committees and being able to share that lived experience and support others. So that was shared. And there was one other about the MAC and BAC working with DCBS throughout this process. So maybe when we come to the end, I know we do have Veronica on, and she would be able to probably share intentions on working cross-agency throughout this process. I do see that Theta raised her hand. Theta should be able to talk.
Yes, ma'am. I had a question. Now, the meetings in reference that you're referring to are 3 hours. Are these during the day, or are these, I don't know when the meeting's set up. I'm just curious because that relates to what I might answer to this or not. So,
Well, and I think we'd love your recommendation on when you think they should take place or if that should be considered. I'm not aware of what their current schedule is, and the BAC will be a new committee. So do you have recommendations on how often it meets and maybe the time of day it's scheduled?
well, I think it's important to take into consideration that if these are during the day, I don't know how the other two councils or that sort of thing meet, but a lot of those people that sit on some of these councils are already have jobs. They're appointed to that, and their salary is covered through that time frame for whatever agency they work for, whether it be a provider agency or whatever, to sit on that council. But when you incorporate lived experience into that, you have to consider compensating them because they're taking time out of their regular schedule, out of their day. This is not in their normal realm. They are not getting paid salary for this time if the meetings are during your 8 to or 7 to 3, 9 to 5 business hour kind of thing. So I think it's important to take that into consideration moving forward. Just something to think about on that.
No, that's excellent. Thank you for that feedback, and that will be noted. Anyone else with feedback or suggestions, or Theta, feel free to come off mute again, about just how often these groups meet, and if quarterly or 6 times per year feels fine to this group, we'll take that as is. But just wanted to give some time if anybody has other suggestions.
Looks like Shannon has her hand up. Shannon, you should be able to talk.
Yes.
There we go.
Thank you very much. I just wanted to say that the MAC meeting 6 times a year, I think that would be a minimum. I think reducing that back would take the MAC meetings to be even longer. And I certainly understand that for the, I think the MAC meetings times may vary. They used to be at 10 a.m., but they may have been moved back to 1 p.m. But they are now all online and all on Zoom, as are all the TACs. But certainly for the BAC, I could understand that they would need to have consideration for their schedules, and timing might need to be outside of that. But I did want to express that I have never served on the MAC or a TAC, nor would it be appropriate for me to do so. But I do listen and pay attention to multiple TACs in the MAC, and absolutely am allowed to participate for those folks that I represent whenever it is necessary. And so I think it's important for folks to understand that please pay attention and participate. From a structural standpoint, the size and the time considerations are, you have to have a quorum, I would assume, in order to facilitate and move forward recommendations that Medicaid would have to consider whether to implement. And I'm not sure I understand the relationship between the MAC and the BAC. Is the BAC a technical committee? Or are the MAC and BAC operating parallel to each other, like a?
They will be complementary committees. The BAC will be members, and the membership will be entirely those with lived experience. And so former or current Medicaid members.
And they can make recommendations to Medicaid just as the MAC would?
Yes.
Okay.
Yep, they'll both be in that advisory role.
And then just as a reminder, the BAC needs to meet before each MAC meeting, right? So that those individuals that participate on both, right, are prepared for that MAC meeting as well.
Great. Thank you for that, Shannon.
I
Oh, sure. You're putting your hand down. That is
Yeah,
great.
I'm
Thank you
sorry.
for that. No, that's quite all right. Thank you for feedback. And maybe I'll just add one more question to this group because we've heard it. Again, I'm looking at the clock. We've got a couple minutes left. And Brian, if you have additional information to share, we want to hear from you as well. But just building on that support component, we've heard it from many of you about how the state can support members on these committees. We heard a real calling out that TA and education, also compensation to offset the cost of participating as members for some of you. Is there anything else that should be considered in how the state can support members in participating on the MAC or the BAC that we should hear from you today?
While we let folks put hands up, there was a comment aligned with this question answered in the written section around meetings being held currently by Zoom and asking whether or not it'd be possible to have in-person meetings, even if there were size limitations to allow for that kind of audience. So I thought I'd share that feedback. It looks like we have Brian's hand up, so I'll unmute.
Thank you. I have a comment along the same lines. I think I agree at least quarterly, but again, the MAC has already expanded to 3 hours, so I think reducing that would be unfruitful. But also, if the BAC is going to be dealing with all the same issues and those things, it should probably be a similar schedule. I think as far as the in-person and virtual, I think it should have, at least be 50-50 because I think it's going to be very important for especially the BAC members to feel involved, that we have face-to-face meetings and that we bring them in and make sure that, there's nothing like the handshake and those types of things. So definitely at least half, if not more, need to be face to face. And also, I think that I agree with Theta's statement that a lot of these provider entities are working during that time, but these individuals who are asking to come are Medicaid recipients or they are family members that are taking time away from their work to attend. And so they definitely need to be compensated for their time. And because this can be, obviously CMS sees it as a very valuable piece to the programs. And, we're seeing more and more of this be expanded in all programs. And so we need to make sure that we get that participation that we're looking for, that they're able to attend and they're able to participate and their voices are heard. Thank you so much.
Thank you, Brian. And I thought we had one more hand up, but it might have gone down. But really just appreciate all this great feedback. Oh, it's back up. So we will hear from one more person before we close out this meeting, but it's been great feedback. Stephen?
Yeah, I feel like there's probably some things that we didn't quite get to today. And I guess the discussion is great because that's what you wanted to hear is feedback from everybody. But we didn't really get into the role over time as these changes are made of the tax. And I just want to take a minute to talk about how vitally important the tax are. Because the tax are where these different groups have a chance to get together and voice their concerns with Medicaid, who are present at those meetings. And in the past, they have all had a representative that then went on to the MAC meeting to make sure that their viewpoints were shared among the full MAC. And I'm interested to see as this shakes out how that relationship is going to work, because to me, it's vitally important that we continue the tax setup so these different groups still have their voice, and working out the way that that's going to function with the MAC and with the BAC is going to be very important. And while I am fully in favor of in-person meetings and always feel that you get more done in an in-person meeting than on Zoom, I do think that the comment has been made and made and made that the issue with all of these meetings, the TAC, the MAC, the BAC, is that they occur on work days during work hours. This affects the providers. This will affect the MAC members. This will affect the BAC members. And when you're talking about the potential that some of these individuals could potentially serve on 2 or 3 of these groups, that's a large time commitment to keep in mind that you're asking for these folks. And I posted a comment in the Q&A that I would really like you to consider that it may not be prudent to cut the TAC members to 1 term and 1 term only, that they can't be reappointed. Because in a lot of these groups, while we get a lot of feedback and a lot of people have concerns, because of the time that the meetings are, we often have real trouble finding providers willing to be actively involved in the TAC process. So that's just something to keep in mind as you're moving forward.
Thank you so much for that, Stephen. I'm glad we had the time to take to hear from you. That is great feedback, and will be captured within all of the other great feedback we received today. I know we're at time, so we want to be cognizant of that. I think there was just a next step slide. I will hand it back to Nicole to just close it out.
Perfect. All right, we can go to the last slide. Beautiful. All right. So as I mentioned at the start of today's conversation, the presentation and the recording will be on the Department of Medicaid Services website. Now you will receive an email, and this will occur after Wednesday's forum. An email with the QR code that is on your screen right now, if you want to take a picture while it's up there. And that has a survey. So I know that we heard from a lot of people, but we also had a lot of attendees that maybe didn't have the chance to ask their question in the chat or live during the call. So that survey will be available for you to provide additional thoughts on the MAC and BAC, and that the survey will be open until Monday, December 23rd. And then, as we did cover a lot of ground today, we do intend to provide key takeaways from the discussions that occurred this week, as well as the survey responses. So we do thank all of you for your time, participation, and really insightful and helpful feedback. And then as a reminder, the session on Wednesday, you are certainly invited to attend both sessions. And so we'll be covering the same topic areas as well. All right, thank you. Have a wonderful rest of your day.
Pretty much everybody's off, right?
I think we have about 25 attendees still rolling off. Caitlin, are you able to put us back into a practice session? Still got about 12 folks on.
I don't know. Caitlin, do you have the option to close folks out who may just have walked away from their computers?
Should we just switch to a Teams meeting?
We can do that. We do have a I can like individually remove people, it looks like. Just there's 10 more to go, but we do have a debrief with y'all this afternoon, but we are happy to stay on now too. So up to you all. Do you guys want to chat now or later?
I'm good. We can chat later, but I will defer to Veronica.
Thank you. We'll chat later. Thank you.
Okay. Thanks, you all. Take care, everyone.